For many of us, the most basic everyday tasks are accompanied by a sharp pain that reminds us of the injury we suffered playing sports, putting our hand out to stop a fall, or just from years of hard work. It's a pain that limits our activities, impacts our fitness, and holds us back from enjoying our lives. It affects everything from our work life, our sleep, or reaching for a book, and we all feel the desire to get back to our normal routines uninhibited by that pain. Commonly, shoulder pain occurs from a torn rotator cuff, the group of muscles that connects the shoulder blade to the upper arm. This is what gives our shoulder its stability, holding our arm in place, preventing it from dislocating. If left untreated, small tears can grow in severity and size over time. Traditionally, a surgeon will repair your injury by addressing the mechanics of the shoulder, reattaching the torn rotator cuff using anchors that hold the tendon in place. But that may not address the biology of healing. The REGENETEN Bioinductive Implant offers a new solution that supports the body's natural healing response to facilitate new tissue growth and potentially disrupt disease progression. Comprised of type 1 collagen, a substance found throughout the human body, the REGENETEN Bioinductive Implant is placed on a damaged rotator cuff tendon through a few small incisions and creates an environment that facilitates rotator cuff tendon repair. Over the course of 6 months, your newly grown tissue integrates and remodels into the healing tendon. The REGENETEN implant is capable of being used on both partial and full thickness rotator cuff tears. In patients with full thickness tears, preliminary evidence indicates a reduction in re-tear rates compared to the standard of care, whereas no tear progression was observed by MRI in any patient at 24 months in a study on partial thickness tears. Most importantly, patients treated with a REGENETEN Bioinductive Implant have seen results in their everyday life, with clinically meaningful improvements in pain and function scores at 1 year compared to pre-operation values, and 94% patient satisfaction after 1 year in a study on partial thickness tears. Coupled with that, multiple clinical studies have shown the REGENETEN Bioinductive Implant to be a safe and effective solution for rotator cuff repair. The REGENETEN Bioinductive Implant, redefining healing potential so that you can get back to the things you love in life quicker and with confidence.